Hello everyone, my name is Omide Abdullah, and today I'm going to be talking to you guys about alcoholism and problem drinking. And so alcoholism and problem drinking are two types of substance dependence disorders that are defined by several different behaviors, such as needing alcohol in your daily activities, the inability to reduce your consumption of alcohol, binge drinking, and continued regular consumption of alcohol despite known health problems, and others. And an alcoholic is someone who's physically addicted to alcohol, while problem drinkers have social, psychological, and medical problems that result from the use of alcohol. And through twin studies and various observations, it's seen that alcoholism has a greater frequency in sons of alcoholic fathers, and genetic factors can play a role in this. And it's been seen that men have commonly been at a greater risk for alcoholism than women, but younger women and women who work outside the home seem to be catching up. And also, sociodemographic factors like low income can also be used to predict alcoholism and problem drinking. And one of the biggest reasons that people turn to alcohol is because of the stressors they face, like negative life events, environmental stressors, and minimal social support. And they consume alcohol because they want to increase their positive emotions and reduce negative emotions, which this pattern has been seen greatly in college students and younger adults. And people tend to relate drinking with pleasant social interactions like attending parties and going to the bars, so they view it as like a psychological reward. When looking to treat a alcoholic or a problem drinker, the first step is usually a detoxification that's medically supervised, which then allows for the beginning of therapy. And one common therapy is cognitive behavioral therapy, which is a technique that teaches people behaviors that prevent the use of alcohol and modifies their environment to include reinforcement activities that don't allow them to go back to consuming alcohol. And then they also undergo relapse prevention techniques, which keep them from relapsing and going back to alcohol. Also, drunk driving is a common tragedy that occurs between alcoholics and problem drinkers, and there's been increased attention by the media to help drivers self regulate themselves to prevent doing this act. And most countries have experienced declines in crashes and fatalities throughout the early 1980s and 90s, but in some countries there's been a slight reversal, which is something that we would like to avoid. Here you can see an overall decrease in alcohol-related traffic fatalities in the United States until 2002 with a slight plateau. Lastly, these are my works cited. Thank you very much.